Have you met this word before, humoral? Humoral just means liquid, right? Has nothing to do with funny. I wish it did, right? But it doesn't. So ancient times, ancient medicine, they used to say the body is made of 4 humors or 4 fluids, right? Blood, bile, urine. There's one more, but I can't remember. So anyway, ancient times, right? So we still call it humoral control. All that really means chemicals in the blood. That's humoral control, okay? So what are the chemicals in the blood that affect vessel size and blood flow? All right, well, we have a list of vasoconstrictors, norepi and epi. All right, we know all about them from our autonomic nervous system talk, right? Angiotensin II is probably one of the most potent vasoconstrictors in the body. It is a component of the renin-angiotensin-aldosterone system, which, yes, you have to say yay after you say that, right? Renin-angiotensin-aldosterone system, yay. No? No? Okay. Much more on that later. We're going to really get into that system. All right, so that's a vasoconstrictor, angiotensin II. Vasopressin. I tend to not call it vasopressin. I call it ADH. ADH is antidiuretic hormone. It does what its name says. It reduces the amount of urine you make. So it's an antidiuretic. It's our desert hormone. Another one, ADH, is a desert hormone. Right? See that? And it's because this is the one that comes into play when we're dry. Okay? So pluck a soldier out of the desert, their ADH is going to be very high because their fluid balance is going to be very low. Now we get to add to that story. Why is it a vasoconstrictor? If you're short on fluid, you're short on plasma volume, right? Less plasma volume is less venous return. Less venous return is less cardiac output. Less cardiac output is less blood pressure, okay? Well, the body defends blood pressure. We opened with that. So when we're very dry, we need to have a lot of vasoconstriction to keep our blood pressure up. So ADH is a powerful vasoconstrictor, right? So it lets us survive and function despite having a significant decrease in plasma volume, being very dry, okay? Now, all of the humoral factors, autoregulation still wins every time, okay? The most important factor in what a particular tissue's blood flow is its precapillary sphincters, right? That's where the major is. This is all about body blood pressure, not about tissue blood pressure. You see what I mean? So these things keep the body's blood pressure high so we can get blood flowing where we need to. Now, we have some systemic vasodilators too. Bradykinin is released in response to injury of tissues. It causes massive vasodilation and increased capillary permeability. It's kind of like, it does many of the same things as histamine. It's just its source is different. Histamine is released by practically all tissues in response to cell damage, and it too causes massive vasodilation and increased capillary permeability. Remember that these effects are pivotal to inflammation, right? We get increased redness from vasodilation. We get swelling from increased capillary permeability. We get increased temperature because of increased blood flow, right? So redness, swelling, warmth, and pain, those are the 4 inflammation characteristics. Histamine accounts for at least 3 of them. All right, ions. The body doesn't directly use ions to affect blood pressure, but ion changes do affect blood pressure. So in other words, it's not something the body does on purpose, but it's something that can happen in disease states. Calcium tends to cause vasoconstriction. I think at this point in the class that shouldn't surprise you, right? You've heard over and over again how calcium is the trigger for contraction. Well, there it is. If you got a lot of calcium, you got a lot of vasoconstriction. Potassium tends to cause vasodilation, and that's because of changes in the membrane potential. Increase in magnesium tends to cause vasodilation. We actually use this fact when we treat acute hypertension in pregnant women. We use magnesium because it's perfectly safe for the baby. It's Mg2+, right? It's not even really a drug, but it's a very good vasodilator. We also use magnesium to stop preterm labor, incidentally. Increase in hydrogen ion, in other words, a lower pH, also causes vasodilation. That should sound familiar because we've talked about that a bunch of times. Acetate citrate will cause a vasodilation, and an increase in CO2 always causes vasodilation, particularly in the brain.